Hey everyone, this is VSG Hopeful. I'm coming to you at 15 and a half weeks. So last Saturday was my 15-week post-op. And I never get my videos done when I'm supposed to. I always just squeeze them in usually when I'm at work. So sorry, not consistent. Anyways, I don't have a lot to come back to you. I never usually do, but I did write a few things down that I wanted to make sure that I shared with y'all. So, as always, I'll start with my stats. My, sorry, my eyes are old and I need glasses, so hold on here. All right, so I started my pre-op diet on November 15th. I was 222. It's the highest recorded weight that I've got. I'm sure I was higher than that, but that's the weight that I was on that date when I started. So my surgery date was December 19th. So it was about a month later, and I was down 12 pounds to 210 pounds on the day of surgery. So April 5th is today, and this morning I weighed 157. Although I had a follow-up appointment today with the surgeon that removed my gallbladder, and his scale said I was 165 and a half. But again, fully clothed, shoes, but yikes, that's kind of a big deal. So, but nope, it's not, because I don't care, because I'm trying not to focus about the scale. I don't care. I have to go by my scale because it's what I've gone by this whole time for 15 weeks. So I have to continue going by my scale. Anyway, so since November 15th, I have lost a total of 65 pounds. So that is including the pre-op weight. And since the surgery, I have lost a total of 53 pounds. So, yay. But even better than that, even better than the weight loss is the numbers, is the fact that I am down to a size 10 in my pants. And even my pants the 10s are getting big. So I've been buying a few 8s of some of the things that I see that I like. So for example, I had a pair of jeans that I just bought in a 10, and I loved the way they fit, so I bought them in an 8 as well, because I know sooner or later I'll be in an 8 and I'll have some pants that I know that I love. Your body type is different, and I think I mentioned this in my last video or one of my past videos, that I had a bunch of clothes that were size 10s and I couldn't fit in any of them. So I had those prior to my surgery. I couldn't fit in any of them because even though I'm in a 10, my body type is not the same as it was before the weight loss. When your body type is different, it changes. So I actually took all those down and sold them to one of the consignment stores, and they gave me $183 for all my clothes, which was great because it helped me buy new clothes. Anyhow, so that's that. My surgeon, Dr. Duffy, Stephen Duffy out of McKinney, Texas, who did my gallbladder surgery, he's the one that I went and had my follow-up with today, and he's fabulous, by the way. Absolutely a doll. I'm just bummed that he doesn't do bariatric, because I totally would recommend him. So he really liked how my incisions were healing and said everything seems to be going great. So one of the things that I wanted to mention is so last night I threw up for the first time. Okay, I have never eaten to the point where I have thrown up ever, and it happened last night. So I had bought my son Taco Bell, and I had got one of those little Mexi melts that are like this big and just little Mexi Melt, and I took, I don't know, maybe 3 bites of that. And then I had, a few of his nachos. He had Nacho Bel Grande or whatever. And I had, maybe 4 or 5 of those chips. Um, and that's all I had. But that's more than I've had, like, probably in an entire week. I usually just drink my shakes and then I'll have, like, something soft food for dinner. I don't usually have solids. I don't usually have meats. Um, it's just too hard. So, yeah, so I got really sick, and within maybe 15 minutes of eating, I just ran to my bedroom and grabbed my trash can and I just threw it up. There wasn't a lot to throw up because I didn't eat a lot. There's not a lot of room. But yeah, I did. It was not fun. Yeah. This is the first time that's happened, so a little disappointed in myself that I just wanted it so bad. Yeah, so that was a bummer. The other thing too that's surprised me is that, like, I hear people talk, like, for example, Jiggle Be Gone. You always talk about how, you know, there's just certain foods that you just love, and I think the video that I saw today, you were talking about some kind of a cheese on a cracker or whatever, and you also mentioned that you were going out to dinner or out to eat or something. And I just, like, I don't get it because I can't do those things. I mean, I can go out with my friends to restaurants, but I just can't eat. Food no longer tastes good to me. Food is no longer enjoyable. Does those, enchiladas look great? Hell yeah, they look great. They smell great. That burger looks good too. But I can't eat it. If I were to eat it, I would eat a bite, maybe 2, and I would feel absolutely like I would physically feel sick. I cannot eat it. I have noticed that if I take a Pepcid AC, like an antacid or whatever, which I do over the counter, 20 milligrams of Pepcid AC, it does help. But then I feel like making it easier to eat more is kind of defeating the purpose. So I don't know. I'm really struggling with that. Like, yay, great, I'm losing a ton of weight really fast, but it's kind of sad that that I don't have, like, it's totally changed my outlook on food and the pleasure of food and all that. So I don't know. Again, it's only been 15 weeks, so I don't know. It's ever changing. Every day it changes. What else did I want to say? So I haven't had any dumping syndromes. I have heard some of you talk about having dumping syndromes, and I also have heard folks that lose their gallbladder, that's a possibility. And I did ask the surgeon this morning about dumping syndrome, and he told me that it's less than 30% of patients that have their gallbladder removed experience that. So that is not something that's the norm, and it's not something that the majority of people go through. Nor is it something that sleeved patients typically go through. It is usually something that bypass patients experience. I don't know why I didn't ask why, but that was what he told me. So yeah, I haven't experienced anything like that. Although sometimes, like, after I eat a little bit of food, even if it's good food, like even if I just have like a couple crackers with nothing on, just like some Ritz crackers or I don't know, food. Sometimes my stomach feels like bloated and crampy, like I have to go to the bathroom, but then nothing will come out, or just like a little teeny ball will come out, which is never good. But I'm also not intaking a lot, so if I was intaking food, real solid food every day, then yeah, that would be concerning that only this much is coming out when this much is going in. But this much is going in and this much is coming out. So I don't know. Anyway, he seemed to think that everything was fine. He didn't have any concerns. Although he did say if that continues, that he would be concerned, and then I should come back for a colonoscopy, which is not good. But anyhow, if I gotta do it, I gotta do it. The other thing is my husband. I talked about in one of my past videos that he started the process for his. Well, don't you know, I had my surgery on December 19th, so the end of the year. Well, don't you know, January 1st, of course, our insurance company changed the guidelines, the requirements, and now they added a requirement that you have to be a minimum of a 35 BMI with a comorbid condition, which he is, but you have to have been that and been treated for that for 5 years, which he has not. So because his has been sorry, that's my office phone. His has progressively gone up to the 35. He hasn't always been that. So, but he does have high blood pressure, high cholesterol, and a history of heart disease. And sadly, his father just passed away from a heart attack at age 59 last week. And so my husband is dealing with that right now, and just breaks my heart, which just makes me even more mad that that he's not able to get the care that he needs, the assistance that he needs medically, to help reduce that risk of his, his life ending that way. So anyhows, we've gotten a lot of support from our doctors and even from the insurance company representatives that have said still move forward with it. So if any of you are dealing with an issue, maybe not the same issue, but an insurance issue where it's like a technicality, they have all recommended that he still continue to move forward. And then if the insurance denies his surgeon's, when they submit it for insurance approval, if the insurance company denies it, then the surgeon and his primary care physician will both appeal it, and the insurance company representatives will have to show justification of why they feel that that he's not. They have to justify why they won't do this, because at this point he's extremely high risk for heart disease and heart attack, especially with the history of heart disease in his family, and his father passing and his grandfather passing on both sides for the same